Yeah, my name's John Galvin. I'm an occupational therapist and facilitator of the Green Walking project on Carbis and Perrin wards on the acute mental health inpatients unit at Longreach House, which is a psychiatric hospital based in Camborne and Redruth, and part of Cornwall Foundation Trust. I'm just going to talk to you about the background. I won't go too much in because you've just heard from Jacob, touch on that, but how important the background, the support from Sustainable Centre for Sustainable Healthcare was so important in making the Green Walking Group a success at Longreach House. I'm again going to talk about the importance of occupational therapy-led Green Walking Group to that it's more than an activity, that it actually has an opportunity to assess patient well-being and can influence, we'll say, fast tracking potentially a patient's pathway. And then I'll talk about how green walking in and of itself is transformative to the patient. I'll talk a little bit about that and how, again, occupational therapy tools can capture that transformation quite easily. And then finally, a patient was going to feedback, but because this is a recorded session, the patient declined, understandably. And just talk a little bit about plans for the future there. So in terms of background, I can't say enough how supportive the Trust, Cornwall Foundation Trust, senior management from the start, my Band 7 lead and subsequent Band 7 lead today as well, equally supportive, as well as all the director of the mental health funding us to be involved in the first place. We were really grateful when our application was approved by the Centre for Sustainable Health, and from the get-go, the ward managers particularly, it was unquestioned support of the walking group. In relation to the conference, that was really important because it provided the material, so that there was a conference organized. Jacob and Francis helped to set it up, and that provided the raw material in which to inspire setting the walking group. It provided a network. For example, Julie, who will be speaking late after me, we were able to tie in and talk and share how our progress was going, because it's no mean feat starting from scratch, setting up a walking group that's to run every week. And so that material, that evidence-based material, particularly Rebecca Crowther's reflections on her work on transformative, the idea of walking group being transformative and the model of transformation, that was quite inspiring to hear. I've also involved her thinking in reflecting the transformative aspects that we could see anecdotally in running the walking group. So the walking group itself took place every Thursday. Patients were risk assessed. Clinical risk assessment was quite dynamic, based on patient's presentation prior to running the walking group. We provided, you know, the walking group itself had been risk assessed thoroughly in terms of the actual walking route prior to us even starting it. So preparation, as Jacob mentioned, was put in place. And again, that was in large part due to the conference material that we inherited. So we're really grateful for that. Pretty much set it up on a plate for us to really run, I would say. The walk itself is a 2-mile walk to Carnbray. Almost can see in the distance where I'm sat, just outside in the green space in Longreach. And yeah, it has beautiful views of the countryside, of the Cornish countryside, and Atlantic Sea views looking to St. Ives. It's really therapeutic. One of the sad aspects, actually, that, when I started it off, was a long-term admin staff had said, "Gosh, we've never seen this before," and this is a person who's working for at least 10 years. And I was kind of sad about that because, you know, it's just so immediate on the doorstep. But thankfully, things have changed and people are using Carnbray now more and more. And I would say in part due to the walking group. So after the walking, patients returned to the wards, they would give feedback, and we would document that in a clinical note, you know, highlighting participation and engagement. In terms of the occupational therapy, the significance of the occupational therapy-led green walking group to assess patient well-being, we used Moho tools oftentimes. It doubled up as a community assessment. And as touched on prior, we've actually got experiences of where the data that we were able to feed into the ward round actually led to simple things like increasing Section 17 leave and considering fast-tracking discharge path, you know, where the green walking provided, you know, a presentation of a low-risk patient. Well, why don't we, you know, do a home visit now? And so that was very important. And in addition, talking in terms of the transformative aspects of green walking in real time, I've got a case of a person, Sheila, we'll call Sheila, admitted due to psychotic relapse, presenting very paranoid on the ward. Fear of being raped by males was a constant fear for her, and oftentimes being disengaged. One of the things was for Sheila, walking was an interest, and from the point of view of transformation, when Sheila got to the idea of joining in the walking group, just before the walking group, she would go through quite a transformation from looking quite glum and dour, dressed sort of, you know, without any sort of purpose. She would come alive, and she had walking gear, and she'd put on her walking boots, and it was quite a transformation. Within herself, she was making decisions that were really positive. And interpersonally, while she expressed concern about who was joining the walking group, she appeared to be assured by the shared interests that we all shared in walking group. And so one interpersonal transformation that really stands out in my mind is as we're going up Cornwall Hill, we all were kind of getting a little bit tired and kind of out of breath because it's a bit of a steep climb. And Sheila, you know, stating herself, so I'm out of breath, and everyone joining and saying, yeah, I'm feeling tired too, and laughing about that. And suddenly you have a group where Sheila is part, socially included, and that's the same for, oftentimes the same for the members in the group. And at the top of the hill, where it's a little bit more windy, Sheila's got long hair, and I remember one thing that stood out was her hair blowing in her face, and repeatedly remarking on just the sense of relief being outside, and not worrying about, I was saying, oh, are you worried about your wind in your hair, because it was in her mouth as she was talking, and she's like, oh, I don't care. And and that presentation was also noted on the return to ward, where Sheila appeared calm, appeared engaged, friendly, which was not, we'll say, the normal characteristics, the usual characteristics for Sheila, spending a long time on the ward. The success of the walking group is that it's continued, and unfortunately due to COVID-19 we've had to reconsider walking group, but there are plans in place. Lucy, my colleague, who's just here, if you can see Lucy, she's planning to, she's the sports technician on the ward, and she's planning to run a kind of a Star Wars type event on the ward, using the garden space, a kind of a marathon event where we record our steps, and patients will be involved in that. Plans are involved to go beyond the silo effect, so maybe my Band 7 lead is certainly spoken positively about the possibility of rolling it out where it's feasible, maybe post COVID-19, to other sites in Cornwall. And of course then there's research opportunities that may come with that. And yeah, if there's time for any questions, let us know.
John,